Welcome back to Things You Don't Know, where we take ordinary subjects, everyday problems, and the kinds of questions people live with quietly, and we bring them into the light.
And today, we're talking about something almost everybody deals with sooner or later: dental problems, toothaches, cavities, enamel, gums. And one of the hardest questions in the whole subject is how people are supposed to afford dental care when money is so tight.
Yeah, Chandler, that last point really matters a lot because dental problems are rarely just about teeth. They affect sleep, eating, work, concentration, mood, and sometimes a person's sense of confidence. Dental pain can make people miserable, and when cost gets in the way, small problems can grow into major ones.
So today, we want to keep this grounded and useful. What causes a toothache? What does enamel actually do? Why do teeth decay? How do gums help hold the whole system together? And what can people do when they need dental help, but they feel priced out of it?
And a quick note before we begin: this is practical general information, not personal medical advice, but the goal is to help people understand what may be happening and what steps usually make sense next.
Dr. Weaver, you said something about figuring out and understanding what's really happening. I want to kind of piggyback off that and discuss now what a toothache is really saying. So let's start with the most familiar signal of all, which is the toothache. People know the feeling of throbbing pain, sudden pain, or a sharp jolt with cold water, pain that comes and goes. What, in the broadest sense, is a toothache, Dr. Weaver?
Well, a toothache is a warning signal. It is not really a final diagnosis by itself. It tells you that something in or around the tooth is irritated, inflamed, damaged, or infected. Tooth pain is often related to tooth decay, but it can also be tied to infection, irritation of the tooth's inner tissues, trauma, or in some cases, damage that lets bacteria move deeper into the tooth. As decay advances, people may feel sensitivity to sweets, hot, or cold. And if the tooth becomes infected, an abscess can form, bringing pain, facial swelling, and fever.
Oh, yeah. So when people say, oh, it's just a toothache, that can be misleading. It may feel like one symptom, but underneath, it could be a cavity getting worse, a tooth's nerves being irritated, or even an infection building pressure.
Yeah, exactly. And one thing that makes dental problems tricky is that early decay may cause no symptoms whatsoever. That means by the time pain shows up, the problem may already be farther along than people realize.
Now, that is one of those frustrating truths about the body. Silence does not always mean health,
Yep, that's correct.
and sometimes it can mean danger.
Yeah, the mouth can be moving towards trouble very quietly.
So, Dr. Weaver, let me hand this to you directly. If somebody has a toothache tonight, what should they think first?
First, they should think this deserves attention, not panic, but attention. The American Dental Association's current pain guidance says short term dental pain is generally managed first with non opioid medicines, especially NSAIDs like ibuprofen, either alone or sometimes with acetaminophen, depending on what is appropriate for the person. And the ADA's antibiotic guidance is very important here, too. Antibiotics are not the answer for most routine dental pain, and localized swelling. The tooth itself usually needs some kind of treatment.
So, pain relief may reduce suffering, but it does not remove the reason the pain began.
Right. Pain medicine can buy time. It does not repair decay, drain an abscess, or restore a damaged tooth structure.
And at some point, people should stop thinking, ah, I'll just wait this out, and start thinking, I need to get some urgent help with this problem.
Yes, facial swelling, fever, worsening infection, or trouble chewing, swallowing, or breathing are red flags. Those signs suggest the problem may be spreading or becoming more serious.
Now, Dr. Weaver, let's move to enamel because people hear that word all the time. Toothpaste commercials love it. Dentists talk about protecting it. Parents are told to help their kids preserve it. So, what is enamel really, Dr. Weaver?
But that's such a good question, Chandler. Enamel is the hard outer covering of the tooth. It is the protective surface that stands between the inner parts of the tooth and the daily assaults of chewing, temperature changes, bacteria, and acids. The National Institute of Dental and Craniofacial Research describes fluoride as strengthening this hard outer surface and helping reverse early decay by replenishing lost minerals, which make up the enamel.
So, enamel is basically like armor, but not invincible armor.
Yeah, that's a good way to put it, Chandler. Strong, but not indestructible. Tooth decay begins when bacteria in the mouth feed on sugars and starches and produce acids. Those acids pull minerals out of the enamel. If the tooth loses minerals faster than it regains them, the enamel weakens. Early on, that process can still be stopped or even reversed because saliva and fluoride can help restore minerals. But if mineral loss keeps winning, the enamel breaks down and a cavity forms.
Oh man, and that is one of the biggest misconceptions there, isn't it, Dr. Weaver? People think that cavities just show up, arrive suddenly like a lightning strike. But really, that's not the case. It's a tug of war.
Yes, a slow contest, repeated acid attacks on one side and your mouth's repair systems on the other. That is why habits matter so much. Brushing with fluoride toothpaste matters. Fluoride in community water matters. Limiting frequent sugar exposure matters. None of those things are dramatic, no, but together they can change the outcome of that tug of war that you mentioned.
Yeah, and I think that this is where some people feel betrayed by the phrase, "Oh, I brush my teeth," because brushing is it's very important, but we have to remember it's not magic. If somebody is constantly sipping sugary drinks, snacking all day, or missing the spaces between teeth, then they may still be feeding the process.
That is very true, Chandler. It is not just whether a person brushes, it is how consistently they do it, whether they use fluoride, whether plaque remains between the teeth or at the gum line, and how often the mouth is being hit with sugars and acids. The CDC and the NIDCR both emphasize brushing minimum of twice daily, cleaning between the teeth, limiting added sugars, and getting regular dental care.
Now, I also think it helps people to hear that enamel damage begins before a hole is visible.
Yeah, you're really right about that.
That early stage really does matter.
Yes, it does. Early decay can sometimes show up as a little white spot where minerals have been lost. It does. Early decay can sometimes show up as a white spot where minerals have been lost. That stage is exactly where fluoride and better daily care may help reverse the process before a true cavity forms.
Now, I want to talk about tooth decay and why teeth actually decay. Now, this is where science and everyday life meet. So, why do teeth actually decay so commonly, Dr. Weaver?
Because the mouth is a biologically active environment. It is warm, moist, full of bacteria, and constantly exposed to food and drink. Tooth decay happens when the balance shifts toward repeated acid production and away from repair. If plaque builds up and sugars are frequently available, bacteria keep making acid. Over time, that demineralizes enamel and damages the tooth.
And the key phrase that may be frequently available, one soda with a meal is one thing. Sipping sugary liquid over several hours, well, that's a whole different story.
Yeah, exactly. Frequency matters. The more often teeth are exposed to acid producing conditions, the less time saliva has to help recover. That repeated exposure can push the balance towards decay.
And sometimes people think only candy counts, but sticky snacks, sugary coffee drinks, soda, sports drinks, sweet tea, sweetened flavored water, those can all become part of the problem.
Yes, tooth decay is not just a candy problem, it is a bacteria plus acid plus time problem.
Now, Dr. Weaver, that is a great line. A bacteria plus acid plus a time problem.
And that means prevention is often less glamorous than people want. It's ordinary things done consistently.
Now, Dr. Weaver, let's turn to gums because they do not get enough respect, I don't think. People think about teeth as the stars of the show and gums as just the background scenery.
Yep, and that's a very common mistake. Gums are part of the support structure that helps hold teeth in place. Periodontal or gum disease is an infection of the tissues that hold the teeth. It usually begins when plaque is not removed and hardens, and the gums become inflamed. Early gum disease, called gingivitis, often means red, swollen gums that bleed easily. If it is not treated, the disease can spread deeper, affect the tissues and bone around the teeth, create pockets, and in severe cases lead to loose teeth or tooth loss. The NIDCR notes that periodontal disease remains the most common cause of tooth loss among adults, and that about 2 in 5 adults aged 30 or older are affected by some form of periodontal disease.
So when somebody says, "Oh, my teeth are fine, but my gums bleed a little," now that's not something you should ignore or just some small side issue. That may be the beginning of the structure around the teeth becoming unhealthy.
Yes, sir. You're right, Chandler. That is right. Bleeding gums should not simply be dismissed. Gingivitis can often be reversed with improved brushing, flossing, and professional cleaning. But once the deeper structures are involved, the problem is more serious.
Now, let me ask you this in a more practical way. What is the relationship between gums and teeth? Why does gum trouble affect the teeth themselves so much?
Well, because teeth are not just sitting there like stones in cement. Mm-mm. They're living structures supported by surrounding tissues. When gum disease progresses, the support around the teeth can weaken. In addition, receding gums can expose root surfaces, and those areas can decay as well. Oral health is a system, not a collection of separate parts.
Now, that system idea matters. Teeth, gums, saliva, diet, bacteria, hygiene, they're all connected.
Yeah, they do all connect. And some people have extra risk factors. Smoking remains a major risk factor for periodontitis. And people with diabetes also need strong oral health routines because preventive dental care is especially important in that group.
Now, let's make this especially practical now, Dr. Weaver. Suppose somebody is listening and thinking, okay, fine. What should somebody do when a tooth begins to hurt or when they feel that cold sensitivity that was never there before?
Well, first, don't ignore it. Second, treat symptoms appropriately while arranging dental care. For short term pain, the ADA says NSAIDs alone or combined with acetaminophen are generally the first line of approach for many dental pain situations when those medications are safe for the patient. Sometimes they're not. Third, recognize that persistent pain, swelling, fever, or worsening symptoms mean it is time to move more urgently. And fourth, do not assume antibiotics alone will solve most dental pain problems. The source usually needs dental treatment.
Yes, it does. And people should think in terms of patterns also. Pain with sweets, hot or cold, bleeding when brushing, bad breath that does not go away, swollen gums, a loose tooth. Those are not random annoyances.
No, they aren't. Those are clues. They are better addressed early than late. The CDC notes that yearly dental visits are recommended even for adults who have lost teeth or wear dentures because dentists are also checking for oral health problems, cavities, and other concerns. Regular care is associated with fewer treatments and lower costs over time.
Now, that last point is important because people often delay dental visits in order to save money, and sometimes that delay ends up making the final bill so much worse.
Oh, yeah. Prevention is not just medically wise, it is also often financially wise.
That's absolutely right. Now, let's go directly into the issue that hangs over every bit of this, the affordability. Because a lot of people are not neglecting their teeth out of simple carelessness, they're having to make some hard budget decisions.
Yeah, unfortunately, that is right. And it is important to say that openly. Cost is one of the central barriers to care.
Oh, yes, it is. So, where should people look first when they need dental care and money's so tight for them?
Yeah, a lot of people are facing that these days, Chandler. Yeah.
Unfortunately.
A very important first stop is low cost care pathways that many people do not know about. The NIDCR specifically points people toward dental schools, where supervised student clinics often provide treatment at reduced cost. Dental hygiene schools may also offer supervised preventative care at lower cost. NIDCR also directs people to community health centers, and HRSA supported health centers provide care even for patients who cannot pay the full amount at once, using sliding fee systems based on the ability to pay. HRSA also has a National Health Center finder.
Now, that is huge because those are real options. These aren't just hopeful ideas. Dental schools, hygiene schools, community health centers, those are practical places that people can actually check.
Yes, and for families with children, Medicaid and CHIP become especially important. Federal Medicaid guidance says children enrolled in Medicaid must receive dental services through EPSDT benefit. CHIP also requires dental coverage benchmarks for children. For adults, though, dental coverage under Medicaid varies by state because there's no single federal minimum adult dental package in the same kind of way. And that is getting worse and more complicated under the current administration.
Oh, yes, it is, as as well as the whole rest of the world. So, for children, the national floor is much, much stronger. For adults, it depends more on where you live.
Yes, Chandler, you are correct. What that means is that adults should check their own state's benefits rather than assume they have none. Sometimes the answer is better than expected. Sometimes it is limited, but still, it is worth checking out.
It never hurts to check, and better to be safe than sorry, wouldn't you say, Dr. Weaver?
Yes, sir.
Yes, sir. And there's also a mental barrier here. People may feel embarrassed. They may think, oh, my teeth are too far gone, or I've just waited too long, or I can't afford a real dentist, so why bother?
Yeah, and that shame can be destructive. Delayed care is common, but dental professionals, school clinics, and community clinics see delayed care all the time. The important thing is to begin. Even getting an exam and finding out what is urgent versus what can wait is often a meaningful first step.
And that may be one of the most important lines of this whole episode. Find out what is urgent versus just what can wait.
Yep, because people often imagine one giant impossible bill, but sometimes treatment can be prioritized. Pain first, infection first, stabilization first, prevention next.
And once again, that brings us back to prevention. Brushing twice a day with fluoride toothpaste, cleaning between the teeth, limiting added sugars, and getting regular care when possible. These aren't just health advice, they're cost control advice as well. Now, Dr. Weaver, I want to end on something a little broader here. Dental problems are often treated as if they're cosmetic or secondary, but that's really not true, is it?
No, it's not true. Oral health is still health. Mhm. The mouth affects nutrition, speech, sleep, comfort, social confidence, and the ability to function day to day. The CDC explicitly frames oral health as affecting body, mind, emotional, social, and career wellness issues.
And that really does help explain why tooth pain can feel so consuming. It's not just a tooth, it's your ability to eat dinner, sleep through the night, focus at work, or speak without
Yep,
discomfort.
that is right. And because oral problems can progress quietly, the absence of dramatic pain does not always mean the absence of a disease.
Well, Dr. Weaver, I'm going to hand this to you for a final summary. If listeners remember only a few things from today's episode, what should they carry with
Well,
them?
I would say this first: a toothache is a warning, not something to casually ignore. Second, enamel is the tooth's protective surface, And decay is a slow, acid driven process that can often be prevented and in its earliest stage, sometimes even reversed with fluoride and good daily care. The gums are not secondary, they're part of the support system that keeps teeth in place. Fourth, bleeding gums, sensitivity, swelling, or pain are worth acting on early. And fifth, if cost is the barrier, there are still pathways: dental schools, dental hygiene schools, community health centers, Medicaid and CHIP for eligible children, and state based adult options that are worth checking out.
And in plain language, brush twice a day with fluoride toothpaste. Clean between your teeth. Try to cut down constant sugar exposure. Do not ignore bleeding gums, and don't treat swelling or fever like a minor footnote.
Yep, your teeth do not exist apart from the rest of your life.
No, as a matter of fact, in some ways they can kind of shape your life. And your mouth is often telling the truth before the rest of you even wants to listen.
Yeah, that's well said.
Thank you guys so much for joining us for this episode of Things You Don't Know.
And if this episode was useful, share it with someone who might need it, because practical knowledge can spare people pain.
And sometimes the most important subjects are the ones that people deal with quietly.
Absolutely. Well, listen, for Chandler Foster and myself, I'm going to bid you a farewell. Hopefully, you'll come back soon, and we'll see you next time. Bye for now.